Hello, today is World Diabetes Day, 14th November. We are observing World Diabetes Day today. We don't celebrate Diabetes Day because we the doctors don't celebrate disease. Diabetes is a disease. So we are observing World Diabetes Day. So on behalf of Dr. Mohan's Diabetes Specialty Center, I'm wishing all diabetic patients all over the world, be it type 1 or type 2 diabetic patients, a very safe, healthy, peaceful and quality life ahead with as less complications in life as possible. And those who are fortunately not yet diabetic, not even pre-diabetic, so I'm requesting all of you, please be aware, get informed yourself as much as possible. Nowadays we have so many sources of data that you can get yourself well informed. And those who are having positive family history, like on the mother side, on the father side, so those who should check their blood tests, including once in a year doctor's visit, to get themselves aware whether they have already developed the pre-diabetes or not. Because so far as statistics in India is concerned, it was seen that those who are having both parents are diabetic, by the age of 50 years there is a chance of developing diabetes up to an extent of 92%. So out of 100 such patients, 92 patients will develop diabetes. I'm talking about type 2 diabetes, of course. So it is my earnest request, those who are having family history, those who are having a history of pre-diabetes, they should get themselves checked on a regular interval, at least once in a year, if not more frequently. So I just tell you today very briefly my 5 T mantras in life. Why are these mantras? These T for times. So these mantras will, if you follow, will help you to alleviate or help you to stay away from developing the complications of diabetes, because we know that somehow or the other we can't be able to stop the development of diabetes because it is genetic disease. Yeah, of course there are environmental factors, but in the form of, say, lifestyle, stress, anxiety, diet, faulty dietary habits. So these are acting as a synergistic, as a catalytic actions to develop it from a stage of pre-diabetes to full-blown diabetes and then to the complicated diabetes. So our aim is to make patients as less complication as possible. Means our agenda is to more complications free diabetic patients rather than diabetes free patients, because we the Southeast Asians have a genetic preponderance of developing diabetes in comparison to the rest of the communities, but we can prevent the complications, and most of the casualties, comorbidities, the troubles developed in diabetes patients' life is because of this development of the complications. So that's why we have to get rid of the complications. That's our mantra. So I have somehow prepared 5 T mantras which, if a diabetic patient can follow in life, at least will help him or her to develop complications as late as possible, or he or she can even prevent the development of complications. Now the number 1 T, times. Times means how many times you have visited your diabetologist or endocrinologist over last 1 year or in the next 1 year. The target will be at least 3 to 4 times per year, if not more. Second T, times, how many times you have checked your fasting blood sugar, postprandial blood sugar and glycosylated hemoglobins. The target, the suggestions from me is at least check it 3 to 4 times per year, if not more. Number 3 T, times, how many times you have checked your BMI, means the body weight and the blood pressure. My suggestion is make it a habit of at least checking it 3 to 4 times per year, if not more. Number 40, how many times you have walked. I'm not asking about strenuous exercise, moderate to severe exercise, the stretchings, the flexibility training, or the resistance training and all. The simple aerobic exercise or the cardiac exercise, that is walking. So we follow it in terms of steps. So my suggestion is at least try to make it a habit of walking 10,000 steps per day, at least 5 days in a week, provided there is no orthopedic or cardiac contraindications. So make it a habit of at least 20 times of 10,000 steps walking in a month. So how many times you have done it? The more you do it, the more will be the benefit. And last but not the least is the times, means time in range. It's a part of the continuous glucose monitoring, which has become a part and parcel of effective scientific precision based diabetes management nowadays. Today, on the eve of World Diabetes Day, the American Diabetes Association has already included this time in range in their standard operating procedure, in their guidelines, in their modus operandi of dealing with diabetic patients, be it type 1 diabetes or type 2 diabetes. So time in range means how much time your blood sugar is within an acceptable range of 70 below, and upper limit is 180 milligrams per deciliter. The more the percentage of your blood sugar within this time in range, the more will be the complication free life you can expect. So it is acceptable that if you can try to maintain this time in range by 70%, that will somehow help you to attain a glycosylated hemoglobin of 7%, which is somehow acceptable, if not below 6.5, but at least if we can try to reach it by 7%, that will help to prevent all the micro and the macrovascular complications of type 1 and type 2 diabetes, namely the diabetic neuropathy, diabetic nephropathy, diabetic retinopathy, the diabetic ischemic heart disease, heart failures, stroke, peripheral vascular disease, so on and so forth, and a lot of other pathies. So the more is the time in range, less will be the complications of life. So that's why my suggestions to all diabetic patients, especially those who are newly detected, make it a challenge in your life that the first 10 years you have to beat diabetes. If you can maintain your parameters, if you can continue to maintain your parameters for the first 10 years of your diabetes duration, it is a guarantee, 99% guarantee, that the remaining part of your life you will be able to lead a fully complication free diabetes. So that is a guarantee and that is an established fact. Continue to have a healthy living. Take care and bye bye.